Assalamualaikum. I'm Dr. Muhammad Ali Rabbani, and the topic of discussion for today is blood supply of brainstem and spinal cord. So, by the end of this lecture, students should be able to describe the blood supply of brainstem and spinal cord, and list and explain the arteries taking part in blood supply, and briefly describe the lesions associated with these blood vessels. Blood supply of brain is through two major vessels. Anteriorly, there is internal carotid artery, and posteriorly there is a pair of vertebral arteries. Internal carotid artery comes from common carotid artery, which is a direct branch of uh, aortic arch for the left side and brachiocephalic artery for the right side. And vertebral artery is a branch of subclavian artery. These two arteries in anastomose with each other via circle of Willis within the brain. So here you can see there's a schematic diagram that shows that these are two vertebral arteries shown in the previous picture. They join to form basilar artery, and there is internal carotid artery. They form the circle of Willis. The actual formation of circle of Willis is beyond the scope of this lecture, so we should skip it and focus on the topic on hand. So the topic on hand is blood supply of brainstem. Blood supply of brainstem is majorly through two arteries, that is the vertebral artery. There are two vertebral arteries, one on each side. The vertebral artery, it originates from this subclavian artery, first part of subclavian artery, and after the origination, it uh, ascends within the foramina in the transverse processes of the cervical vertebra. So these are known as uh, transverse foramen or foramen transversarium. So after ascending through all the cervical vertebra, it enters the brain cavity, skull cavity, in via foramen magnum, and within the foramen magnum, it pierces the dura mater and runs within the side space. So here is a view of the inferior view of the brain. You can see the paired vertebral arteries that are ascending through foramen magnum, and they are on anterolateral surfaces of the medulla. So you have seen that after passing through the foramen magnum, they terminate by joining with one another. When they join with one another, the artery, single artery that is formed in the midline is known as basilar artery, and this joining happens at the lower end of pons. So let's see what are the branches of the vertebral artery. First of all, this is the anterior branch, most prominent. Uh, Both vertebral arteries give a branch that those two branches join in the midline to form one common artery. This artery is known as anterior spinal artery. It runs in the anterior fissure of the spinal cord. Then there are posterior inferior cerebellar arteries. These are the arteries that are originating. They goes to the inferior surface and then on the posterior surface of the cerebellum. We will have a better view when we see it from the side view. Then there are posterior arteries, and posterior arteries, these are the posterior arteries. We will go into the detail in the following slides. There are two posterior arteries and they run as a pair on the posterior aspect of the spinal cord. I have a slide giving in detail of the posterior spinal artery. Let's revise all these three in the lateral view. This is the anterior spinal artery formed by the joining of the branches from both vertebral arteries running in the midline anteriorly. Then there is posterior inferior cerebellar artery. Here you can see that it is swings around the laterally around the medulla. Then it runs on the under surface of the cerebellum going up to the posterior surface. So this is posterior inferior cerebellar artery. This is the posterior spinal artery. Here, posterior spinal artery. Posterior spinal artery can arise either from vertebral artery itself. Here in this picture, it is arising from vertebral artery, or it can be arising from the posterior inferior cerebellar artery. More commonly, it is arising from posterior inferior cerebellar artery. There are different meningeal branches like here and here which supply the meninges and bone of the posterior cranial fossa, and there are small branches that penetrate the substance of medulla and supply those also. Let's see briefly arteries one by one. We have seen anterior cerebral artery. The origin is from joining from the branches of both vertebral arteries, and it runs in the median fissure and lower in the spinal cord. It is reinforced by radicular arteries. We will go to the radicular arteries when we study the blood supply of spinal cord. Then there is posterior inferior cerebellar artery. Here you can see it, and it is the largest branch of the vertebral artery, and it has an irregular course between medulla in front and cerebellum behind, and then it runs on the inferior surface of the cerebellum. It supplies various areas, like here by passing through it supplies the lateral surface of medulla, and then here it will supply the vermis and central nuclei of cerebellum, like it's in the midline. Then it supplies the undersurface of cerebellum, and the branches that go back may ultimately take part in the choroid plexus. Not the arteries. Some of the arteries from here may take part in the supplying of choroid plexus of fourth ventricle. You may remember that choroid plexus, fourth ventricle, is present between the upper part of medulla in front and cerebellum behind. Then there is posterior spinal artery. Posterior spinal artery may have two types of origin. It may be a direct branch of vertebral artery, as is the case in this particular picture, or it may be a branch from posterior inferior cerebellar artery. It can be arising from here. So these are the two possible origins of the posterior spinal artery. I have highlighted this is the more common origin of the posterior spinal artery. They are pair and they descend close to the posterior root of spinal nerves. We will see that we go into the spinal cord. Then there are meningeal branches. They are small and they supply the dura and bone of the posterior cranial fossa. And medullary arteries are not shown in the picture, and by the name you can understand that they supply the medulla. So these we have seen the basic route of vertebral arteries, their origin. They basically route their termination into the basilar artery, and we have discussed its branches: anterior spinal artery, posterior spinal artery, posterior inferior cerebellar artery, meningeal branches, and medullary artery. Let's move on to study the basilar artery. You can we started basilar artery. We were introduced in the previous section when we said that two vertebral arteries join to form basilar artery. This joining occurs at the lower margin of the pons. So after it forms, it runs or ascends in the midline in the median fission of pons, and it terminates at the upper margin of pons by dividing into two arteries that are posterior cerebral arteries. These are the posterior cerebral arteries. So you can easily say that basilar artery has a length equal to the pons, and it starts at the lower margin of the pons and it ends at the upper margin of the pons by dividing into posterior cerebral arteries. Let's see the branches. So just now I said that basilar artery ends by dividing into posterior cerebral artery, two posterior cerebral artery, a left one and a right one. So this is a branch of basilar artery. Then there are superior cerebellar arteries, and they wind around and go to the superior surface of cerebellum. We will see in the lateral view. Pontine arteries, there are small branches that are arising from the basilar artery and supply the anterior surface of the pons. They are also known as paramedian arteries. As you can see, they are arising from the midline. Then there is labyrinthine arteries. The word labyrinthine, it denotes that it goes to the inner ear. So these are the branches that goes to the inner ear. And anterior inferior cerebellar artery, and they wind around the upper part of pons, or rather we can say the pontomedullary junction, and they go to the anterior and inferior surface of cerebellum. Let's see these arteries again from a different view. So this was posterior cerebral artery, and this is superior cerebellar artery. Here you can very well see it is going on to the superior surface of cerebellum. Pontine arteries, labyrinthine arteries, it is shown here in close association with the uh, eighth nerve and seventh and eighth nerve, facial nerve and vestibulocochlear nerve. Its further part is not shown in this picture. Anterior inferior cerebellar artery. Here it is in the anterior surface of the cerebellum and then goes to the inferior surface of the cerebellum. So let's see them one by one. Pontine arteries, they are multiple in number, paired on either sides, and small, and they supply the pons anteriorly. Then there is anterior inferior cerebellar arteries, and they supply the by the name which shows the anterior and inferior parts of cerebellum. Also, some neighboring regions of the pons and medulla are also supplied by this artery. Superior cerebellar artery, it supplies the superior surface of the cerebellum, also some part of pons. About here, about here is the pineal gland. It's a give branches to the pineal gland, superior medullary velum, and these are supplied by also some parts, of course, supplied by this artery. And there is labyrinthine artery. You may have not studied yet, but facial nerve, eighth nerve, vestibulocochlear nerve, leaves the posterior cranial fossa through the um, internal acoustic meatus to the internal ear and wherever it goes, and also for the same opening internal acoustic meatus, seventh nerve also leaves the cranial cavity. So labyrinthine arteries enters with these two nerves into the internal acoustic meatus and it supplies the inner ear, and it may arise from anterior inferior cerebellar artery. An important thing I want to say that these vessels are often not called by their full names but their abbreviations like AICA. So you must have these abbreviations in when learning. So there are posterior cerebral artery. It is a very big topic and it will be covered tomorrow inshallah by Dr. Hamd in the blood supply of the brain. But we can give a basic idea that these are the arteries that this is the midbrain. You can see like here is the midbrain. Posterior cerebral artery, they wind around the midbrain to go posteriorly, and they have a few major branches like here are the cortical branches that go to the cerebral cortex, and they supply the temporal lobe and parts of temporal and occipital lobes. Then there are central branches and they go deep within the cerebral cortex and supply the central nuclei, thalamus and few basal ganglia. There are choroidal branches that goes to the choroidal plexuses and helping them in the formation of CSF. So you have now studied the different blood vessels, their branches, and you have seen in the pictures how they move around different parts of brainstem to the other structures. So here is another way to see those. So midbrain you saw on the top of brainstem, it was uh, supported by posterior and superior cerebellar arteries, and then there is it anteriorly it is supplied by basilar artery, pons anteriorly by paramedian branches of basilarity artery, and laterally and posteriorly by different arteries that were going to the cerebellum. And medulla, anteriorly it was supported by vertebral artery direct branches, or when the vertebral artery gave branches as anterior posterior spinal arteries. Then there was posterior inferior cerebellar artery, and of course the upper part of medulla can be supplied by basilar artery. So venous drainage, I am not going to discuss with you in detail the different veins within the cerebral cortex. It will be covered in your next lecture, inshallah. But here you can see in the picture that midbrain is here. The venous drainage from midbrain goes into this basal vein and also your great cerebral vein, this great cerebral vein, or other great big cerebral veins that are near it. pons. Here is the pons, and it also part of it drains to basilar vein. Here is the cerebellum. Near to it, venous drainage also goes to the cerebellar veins or neighboring venous sinuses. The sinuses you studied with the meninges. And then there is medulla oblongata. Part of it drains through the spinal veins, and part of them are drained through neighboring sinuses. If blood flow is impaired or it does not occur sufficiently, the part of the brain that is supplied by that blood vessel may get affected and clinical symptoms or syndromes may result. But how can blood flow be impaired? There are a number of ways in which a blood flow of a vessel can be interrupted. There can be postural hypotension. There are some people when they stand up, their blood flow drops, and as brain is the highest part, so that is very early affected. Then can be physical shock due to trauma or bleed or maybe infection, or then can be psychological shock. There is vasovagal response and a huge parasympathetic outflow that um, leads to dilated veins and drop of the blood pressure, and drop of the blood pressure affects brain, of course. There can be blood viscosity changes. For example, if there is polycythemia due to some abnormality, blood becomes viscous and blood flow becomes slow and sluggish. Carotid sinus syndrome. There are carotid sinus bodies in the carotid arteries that detect high blood pressure, and when they are activated, they send the signal to lower the blood pressure of the body. If they are activated without any reason, good reason, and they are overactivated, they may lead to the hypotension. Of course, there is heart disease. Heart disease may affect directly by inability to pump blood to the brain, or it may affect indirectly. For example, if there is atrial fibrillation on the left side and clot forms and clot will run towards the brain. Then can be arterial wall disease. Most common by known by you is atherosclerosis. Wall becomes thick and it narrows down the lumen. May be blocked directly. For example, there may be embolus moving from a atrial fibrillated heart, or for example, there can be embolus from another cause. There can be thrush formation. So these are the different causes from which blood lumen may be narrowed. So what happens if a particular artery is blocked? So you saw that there was anterior spinal artery forming in the midline, or there were two vertebral arteries here. So if the vertebral arteries or the anterior spinal artery becomes blocked, the anterior part of the medulla, this shaded area of the medulla becomes involved, medial medullary syndrome. I will not go into the clinical details. You have done with them with the medulla, pons, and midbrain. For the details, you can go and refer to those lectures. Then there is lateral medullary syndrome. You saw that posterior inferior cerebellar artery wound around the medulla to go back to cerebellum, and during that path, it gave branches to the medulla. If that artery is interrupted, this lateral part of medulla is damaged. That is lateral medullary syndrome. Similarly, there was basilar artery in the going in the midline, giving paramedian branches. If that paramedian branches, basilar arteries are involved, then near the midline, pons will be damaged. That will be median pontine syndrome. And if the anterior inferior cerebral artery or superior cerebral artery is damaged, they were going around the pons to the cerebellum, so they get damaged, then lateral part of pons will be damaged and it will have the syndrome and sign and symptoms according to what of the structures are involved. Similarly, there can be medial midbrain syndrome in the midline branches of posterior cerebral arteries. As they were winding around, they were damaged, so the crus cerebri, they become damaged and leads to contralateral hemiplegia, and if cranial of 3 involved, it leads to a whole other list of symptoms. So these are a few examples of how a damage of or occlusion of or in simpler words, so interruption of a blood supply for particular artery can affect different parts of the brainstem. And it goes without saying that you need to be very confident about the different structure and cross sections of the brainstem so that you may reduce what clinical symptoms will be produced by damage of a particular part of brainstem. So moving to the next topic, blood supply of spinal cord. There are two type of I will broadly classify them on two types. One are the longitudinal vessels that run throughout the length of spinal cord, and they arise in the skull cranial cavity. You know them already. One anterior spinal artery in the midline, and a pair of posterior spinal arteries in behind. They run throughout the length of spinal cord, and as they move down the spinal cord from cervical, thoracic, and lumbar regions, and each segment they are supported by feeder or segmental arteries. They are the arteries that are originally arising outside the vertebral column, and through intervertebral foramen at each level they enter and they reinforce the anterior and posterior spinal arteries and help the maintain the continuous flow of blood. So let's start with posterior cerebral arteries. In the brainstem, we also saw that posterior cerebral artery may have one of the two origin. One is that it may be a direct branch of vertebral artery that is shown here. It may be a direct branch of vertebral artery, or it may be a branch of posterior inferior cerebellar. They are paired arteries and they move very close to the posterior roots, the dorsal roots, the sensory roots of the spinal nerves, and they are paired and they move throughout the length of the spinal cord down to its end. And throughout its length, they are reinforced by the segmental arteries. We will see segmental arteries shortly. Uh, you can well understand by yourself that the length of spinal cord is considerably long, and the blood that is entering up in the cranial cavity into the posterior spinal arteries cannot be sufficient to supply the whole length of spinal cord. So the blood flow is maintained through the entry from these arteries, feeder arteries or segmental arteries that enter into the spinal cord and pour blood into these arteries. And they are so important that, for example, in the upper thoracic region and in the lower cervical and upper thoracic region, posterior spinal artery itself is very small and vulnerable, and if the feeder arteries or segmental arteries are cut, this area will go into necrosis or ischemia. So this is how important is the supply of the segmental arteries from the outside, and they supply the posterior third of the spinal cord. Then there comes anterior spinal artery. You saw the anterior spinal artery was formed by the um, joining of the two branches from the vertebral artery, and this happened within the skull cranial cavity, and after forming the joint in the midline down to the whole length of spine. Shown here, okay, it moves throughout the whole length of spinal cord and down to its terminal part. And just like posterior spinal artery, it is reinforced repetitively by the segmental arteries from the outside coming through the interventricular foramen, giving it support. And it is very small in the upper thoracic and lower thoracic region, especially in upper thoracic T4 and lower thoracic T12L1. It is very small in these regions, and here you can see that there are large feeder arteries supplying in this region. There is upper thoracic region, there is lower thoracic region, and here is the L1 region, lumbar region, and these are extremely small in this segment, and without the support of feeder arteries, these areas are vulnerable to get damaged. and they supply the anterior two-thirds of the spinal cord. Arteries up close. So before going into the segmental arteries, you can see here this is the anterior spinal artery going in the median fissure, anterior fissure, and these are the two posterior spinal arteries going in the posterior view of the spinal cord just near the rootlets, dorsal rootlets. So here you can see that in each region the segmental arteries enter the vertebral canal and support the spinal cord, and they enter from the outside through intervertebral foramen. So where do they actually come from? It depends from region to region. Here you can see a familiar picture of thorax. Here is the vertebral ribs, and you can see intercostal spaces. So here is the dorsal aorta, and you can see these are posterior intercostal arteries. You have studied them in detail in your first year. So while going anteriorly to go between the layers of innermost intercostal and inner intercostal, here you can see the posterior dorsal branches give further branches that go inside the intervertebral foramen to the vertebral canal and the support. They are further divided into three parts. Then first are anterior and posterior radicular arteries. Here they are seen here. The branches that go with the anterior root of spinal nerve to the spinal cord, these are anterior radicular arteries. Then there are arteries that go with the posterior root of spinal cord posterior root of the spinal nerve to the spinal cord. These are posterior radicular arteries. I have highlighted them because they are present in each segment of spinal cord. They are invariably present in each segment of the spinal cord, and they are present on each side. You can see they are here and here, and they are here and here also. So then there is segmental medullary artery. Segmental medullary artery are comparatively large branches that instead of going directly to the spinal cord, they go to the anterior or posterior spinal artery. I'll repeat, anterior radicular artery and posterior radicular artery go with anterior and posterior roots of spinal nerve, and they terminate by supplying the spinal cord. They do not anastomose directly with the anterior or posterior spinal arteries running along their length. However, the segmental medullary arteries, they enter the spinal cord, and instead of going to the spinal cord itself, it goes and feeds the anterior spinal artery or posterior spinal artery, and of course from their branches blood will be sent to the spinal cord. They are not present in each segment. They may skip a few segments, and they are not usually bilateral. There is more chances that there is segmental medullary artery entering the spinal cord from the left side. Here also in this picture it is shown in the left side, and there is an artery in the thoracic region, the great artery of Adam-Kivix, and this is also known as arteria radicularis magna, the great uh, radicular artery that is in the thoracic region, and it is the largest segmental medullary artery. So the venous drainage of spinal cord, it's not that difficult. Um, in the arteries there was one anterior and two posterior spinal arteries running parallel to the length of the spinal cord. Here there are a large number of veins that are running in the longitudinally or parallel to the spinal cord. You can see that, and this is the anterior root of spinal nerve. There is a pair with each member on either side of this root. Then there is a pair of nerves that are a pair of veins that are present on each side of this dorsal root. Then there are a pair of veins that are present on each side of this dorsal root. Then there is a pair of veins that is present on each side of this anterior root. So there are pair of veins that run parallel to the spinal cord, and they are on either side of each rootlet. And then there are anterior and posterior midline veins that are also known as posterior spinal vein and anterior spinal vein. So these are present within the dura, in fact within the arachnoid space, and they collect the blood, and the upper part of the spinal cord, they connect with the intracranial veins, and they and drain the blood. Then there are also rest of them through various connections. There is also a venous plexus outside the dura mater. So extradural or epidural, there is venous plexus known as internal vertebral plexus. The venous blood from these veins is sent to this plexus, and this plexus communicates through intervertebral foramen to the outside, and it drains the blood to the whatever venous system is running outside. For example, in the thorax, there is azygous venous system. On the right side, azygous vein, left side, hemizygous, and accessory hemizygous. So it drains the blood into the either side, whatever the veins are present. So when there is a clinical syndrome of anterior spinal artery occlusion, for example, if anterior spinal artery is occluded, or let's say that segmental medullary artery that are supplying the anterior spinal artery, they become obliterated, the blood supply in the anterior spinal artery will become insufficient. And when in spinal artery is not supplying the blood to the spinal cord, anterior two-thirds of the spinal cord will be damaged. So I'm not going much into the detail, but simply speaking, only the dorsal columns are spared. Rest of the spinal cord will be damaged, leading to bilateral sign of spinothalamic tract and spinocerebellar tract and motor system and lower motor neuron at the level. And so this is again the topic of spinal cord, which tract and which nucleus leads to which. But you can here we see that anterior spinal artery damage can lead to anterior spinal artery occlusion syndrome, but two-thirds of the damage of the spinal cord. So this was the lecture for today. The theory was taken from neuroanatomy. I have tried not to deviate away from this book, and the pictures were taken from Nectar Snell and Gray's Anatomy for students. Uh, Thank you for listening, and if you have any questions, feel free to post under the lecture. I will try to answer you as soon as I can. Thank you so much.